Hello, good afternoon, everyone. Today we have Dr. Lee back again with us because this coming Thursday we're going to have our live webinar with Dr. Lee on the 22nd of July. So if you have not registered for this webinar, do join us and click on the link for the registration. So our last two live session, we actually Dr. Lee did share about the impact on those people who suffer with cataract, and then the positivity of the impact, if they have the cataract procedure done. So Dr. Lee, I would like to find out a bit more from you. What would be the lifestyle choices and the visual needs of individual patients, options that is available based on your expertise?
Thank you, Anna. Hello, good afternoon, everyone. So this is our another session to tell you a little bit more about cataract and cataract surgery. So as mentioned just now, I think we all have different requirements. And if you agree that our vision is very important to carry out our day-to-day tasks, I, for one, of course, we all use our mobile phone. I actually use my laptop a lot and play some sports. Some people will play mahjong and so everybody's individual needs are different. So when we talk about cataract surgery, it is not really just a one-size-fits-all. If you think about in the old days where, cataract technology was not quite the same, you're talking about maybe 30, 40 years ago, where it's actually cataract surgery, you go into hospital, they do a surgery to take your cataract out, you have to stay in hospital for a few days, and they may not even put lens implants inside so that you need thick glasses. So we've come a long way now, so much so that for my patients in our center, when we actually have people coming in with cataracts, we have a lengthy discussion to understand what their requirements are. So you might have the very basic people. I won't say basic means bad. It could be the grandma or grandpa or uncle, auntie that, retired in their 70s. They're just enjoying life, go out, meet their friends in the old days before COVID, or watch a bit of TV, do a bit of cooking and housework, no real reading required and things like that. Then they can go for a very basic kind of cataract surgery correction where you put in the lens implant and they can see well enough to do all those activities. So you don't need very specific needs. Then you can move on to people with a little bit more activities where they actually, maybe they do some sewing or they do some driving and they drive at night sometimes, nowadays, grandparents, or they have to drive grandchildren around, tuition or whatever. And subsequently, they have those needs. And then we can actually put in a different lens then compared to the basic requirements and suit their needs. If they need to drive without glasses, or they say, I love to read without my glasses, but I don't mind wearing glasses to drive, then we also have to match that to their requirements. Over the years, I've had to learn it, and we all as surgeons and as doctors will learn it, some ways to find that. I have a patient that I've done a beautiful surgery, put in a lens implant. I mean, we measure them in clinic, they're seeing very well. But when they come into the room, they say, oh, how are you? Or Mr. Tan or something, and they say, actually, not very good, I'm not seeing so well. Then you realize, but I just tested your vision outside, you're seeing so well, but they can't see well to read. Because why? I did not go into detail to understand what their requirements are. And I find out that Mr. Tan loves to read his Chinese newspaper up close without glasses. And now after I've done surgery, he can see very well for far, but for near, he's to wear reading glasses and he's not happy. So there is a mismatch in terms of expectations and what the explanation was beforehand. And that is the prime reason why we spend extra time to make sure that the patients know what they're getting into and we know what they want. Moving forward, then you have the advanced requirements, where I have patients now, typically younger, maybe 50, 60, still active. I have lawyers, engineers, teachers, fellow colleagues. They are driving, they use the computer a lot, they actually surf the net. They have Facebook, they have IG, they actually read constantly their documents, for lawyers, they're preparing things, all the documents as well, and the engineers work with fine equipment. So they need their vision for all those requirements. And they tell me that I don't want to wear glasses. So mafan, so troublesome. Then we have to suit those needs. And that's when we actually use a lens implant so that they can be independent or actually not so dependent on their glasses. So Anna, I think, and also for all of you that are listening, remember, cataract is very common, but doing the surgery also is not so difficult. But what is difficult is to understand what the patient wants and for us as doctors to deliver that to you. So spend some time to ask questions. And for us here, we are very happy to answer all your questions.
Yeah.
And hopefully on Thursday, we will get all the questions there.
Yeah, for those viewers now online viewing our live session, if you do have questions, you can actually post your question into the live chat and then we can address to it as well for now. So Dr. Lee, which means just now you mentioned it's so important to understand the patient's expectation so that they actually can enhance the quality of life, you know,
course,
so
yeah.
that they can actually go back to the normal before even they develop cataract, right?
Yes, I think to some extent, yes and no. I think we as eye surgeons can never restore your 21-year-old
Yep.
eyes.
No,
Yeah.
100%.
No,
I agree.
100%.
Which is
But,
not 100%.
We can go a long way to ensuring that, the quality of life is maintained or enhanced.
Yeah.
Because like I mentioned in previous live show, last couple of sessions is, cataract creeps up on you. They come slowly and then you make compromises. We say, oh, I'm getting old, can't see so well, can't do this, can't do that. And what happens is your quality of life slowly sort of deteriorates if you compare that with, maybe 10, 15 years previous to that. And now what cataract surgery can do, it can be life-changing for the individual because it gives them back years that they have actually been missing.
Right.
And it can be very liberating. And like I mentioned, it increases your confidence, self-esteem. And, it's nothing more exciting for me or for doctors in general when we see the benefits that our patients get and they are so happy when they come back and they tell you that they are really enjoying their life now. So that is very rewarding for us.
Right. I do remember one lady patient mentioned after her procedure and she actually able to do her eye makeup, drawing her eyeliner without the glasses, because with the glasses, it's very hard to put on even with the magnifying mirror also she's having challenges to do a proper eyeliner. So after the procedure, I mean, like just now what you mentioned, there's no 100% in every procedure, but it actually helps a lot, comparatively.
Yes, of course. Like I said, it's life-changing and life-enhancing most of the time.
Yeah.
But important, like I said, can't say it often enough. I'll say it again on Thursday when you go do log in, to make sure that the patient and the doctor understands how to meet each other's or so much more for the doctor to meet the requirements of the patient. So we actually have to understand what their needs are.
Most importantly, I think the patient must understand completely what they actually wanted and be having a realistic expectation. You cannot have the sky, right, Dr. Lee?
Yeah, of course.
You cannot be expecting like the sky results and things like that. So we must have like a realistic expectation as a patient as well.
Correct. So the conversation is important. So we've got to spend time to understand. And if we give that enough importance, because it can be something that will change the rest of your life, then we have to make sure that we understand. So we have to talk about it.
Okay. Dr. Lee, we have one question in the chat.
Oh, really?
Right. It's actually from Michael. Is it possible to go for the basic surgery that move to more advanced once later?
Okay.
All right.
That's a good question. I think, yes, I suppose those that are thinking about, oh, maybe I start off by doing this, and then later on they say, I want to maybe move on and do more.
Actually, this morning we had one patient was asking that in our front office, had the cataract done, which is a basic one. And then he was asking, can I actually sort of like upgrade to a more advanced one?
I think you can. The answer is, well, a bit yes and no. Let's say you've had one eye done. And I have patients come in, one eye done, perhaps elsewhere or by us long time ago. And now the second eye is due. And they find that actually right now, the right eye, I just did something basic. And now I want something so that I don't have to depend on my glasses. We can do that. But the caveat or the potential compromise is that the eyes are different, because one eye has got this lens, the other eye has got another lens. There may be an issue in how both eyes can work together. So if you ask me, it's possible to be done, but not advisable. I would say that if you make a decision, stick with it and accept it. Just as much as I will tell my patient, if you go out nowadays, you want to buy a mobile phone. I think we all need a mobile phone. So if you want to keep chasing the best phone that's out there, let's say cost is not an issue, you will never get the best phone.
Right.
Because every 1 year, 2 years, there are so many brands now. So you choose the Apple iPhone 12, then 6 months later, you got a 12S Plus or 13. It keeps going. So you can never choose the best one. So you can only accept what is available there at that moment and suits your needs and go with it.
Right.
And don't regret now.
Right. Because technology evolved too fast.
Correct.
Yeah. True.
Anyway, we will cover more of this. I think rather than have the whole webinar now, which we could, because we can just talk on and on.
Yeah.
I think I look forward to having more interactive discussion with the public rather than talk with you, Anna. I
true.
see you every day.
True. Okay, so for those who have actually haven't signed up our session yet, do click on the link because slots are limited. So remember to join us on the 22nd of July, which is this Thursday at 8:30 p.m. If you join via the Zoom session, you can have a direct interaction to talk to and consult Dr. Lee, on whatever eye-related matters as well, not just only about cataract. And then otherwise, you can join us at our live Facebook or YouTube session. So for those attendees who actually attended our session, we're also entitled for a free eye screening and also a consultation with Dr. Lee Manwai as well. So not forgetting to like our Facebook page and our YouTube channel. Catch us more information that we will have more upcoming updates for you all. So thank you, Dr. Lee.
Okay, thank you, Anna.
Thank you. Take care.
See you all on Thursday. Bye-bye.
Yeah, bye-bye.